I've been an IVF specialist for many years, and because I'm a second generation doctor, it's equally important for me that the high ethical standards which medicine used to be famous for are maintained. But the tragedy is that doctors aren't trusted anymore. There used to be a time when the default for a doctor was trust, where patients would assume that the doctor was an ethical professional who would do actually what was right for them. So there was no cross questioning, no demanding answers, because patients had this implicit faith and trust that the doctor would do what is right. Because after all, the doctor was a professional, had signed off that his first priority was to take care of patients and would do whatever was right for patients. But unfortunately, that professionalism no longer exists today, as a result of which the default relationship between a patient and a new doctor is often one of distrust. So there used to be a time when you would start off with a positive relationship. A few years ago, it became a neutral relationship, and now it's actually become a negative relationship. What does that mean? That means that doctors have to work twice as hard in order to earn the patient's trust. And this is why, in fact, practicing medicine ethically has become so hard for good doctors. Because no matter what you do, patients are just going to assume that whatever you're saying is not true simply because they've burned their fingers in the past. And actually, I think it's the medical profession which is to blame for this sad state of affairs. Because the reality is that the profession is designed to police itself because we have the expertise. And that's what the reason for the National Medical Council and the Commission was. But unfortunately, we've not lived up to our responsibilities to society. And because we have failed to police ourselves, we're now paying the price.